Thanks, Hank. Really appreciate that setup, and I think we've already started kind of sinking our teeth into costs, which is very exciting because as Hank was saying, we don't often think about them. I'd also like to thank the committee for the opportunity to discuss the state of research around the cost of prevention. This is an area I've been particularly passionate about, not only because cost analyses are the foundation for much of the benefit cost work that we're working with and talking about here today, but also because understanding the resource needs and economic costs of prevention is inextricably linked with the current efforts to take prevention to scale. So whether that be through expanding home visiting programs, developing school violence prevention efforts, or through the creation of a new national early learning initiative, on the ground in local communities, there continues to be tremendous demand for robust estimates of what actual resources are needed to support prevention efforts. Specifically, prevention efforts that can effectively meet community public health needs and reduce strain on overburdened service systems. So in this manner, even basic cost estimates can end up having greater utility for program planning than even some of our best estimates of program cost effectiveness or benefit cost ratios. So I don't know if you're okay. So in an effort to attend to the questions that were raised by the committee, Hank and I, we sought to divide up this session in order to provide the greatest amount of coverage. But before I get started, I too would like to emphasize what I found to be the dismal state of cost analyses in prevention to date. Further, as Hank's discussed, the ingredients-based approach, it represents the most developed method we have for capturing program costs. And when it's used as intended, as it was designed, we can successfully capture the full economic investment required to support a prevention program when it's used as intended. So with the remainder of our session today, I'd like to expand upon some key issues related to the process of costing prevention programs, and then discuss how we can seek to improve our understanding of prevention's resource needs and economic costs. So to build on Hank's discussion of the ingredients-based approach, I'd like to consider three areas that researchers often fail to adequately capture in cost analyses. And we've already started talking about some of them today, which I think is great because Hank and I were whispering about we really need to reinforce this. So specifically, the resources need to ensure adequate programming infrastructure is in place, the resource inputs from donated time and goods, as well as the cost to program participants themselves. So each of these areas are required to replicate a program's effects, and failing to capture the resources needed to support them within our analyses not only biases our benefit cost work, but when these incomplete cost estimates are used in actual program planning, when they're actually used in communities, they can end up jeopardizing the very quality of services being delivered, in this case to children, and the overall sustainability of the prevention effort itself. So it's this dual element of the quality of our research, but also how our research is used in practice and policy. So in a review of the field, we find many estimates of prevention costs end up capturing only the most immediate resource needs of programs. Sometimes these are referred to as day of implementation costs, and they only consider the resource inputs most proximal to programming, but often neglect crucial elements of infrastructure, some of which Margaret was talking about, that are often in place during the evaluation trial. For instance, say local knowledge around how to adopt and implement prevention programs, it varies tremendously on the ground. Many programs now employ manualized training to teach program facilitators how to deliver a specific prevention curricula, but few seek to actually train the managers overseeing those facilitators around how they can ensure that their programs are delivered as they were intended and with quality, or how to plan for threats to the prevention effort sustainability, crucial elements to replicating the effects of the original evaluation trial. So these skills are often taken for granted and assumed available in the existing labor market, but the reality is, due to the very fragmented nature of prevention within the United States, these skill sets may not exist within local labor markets at all. And we find this to be especially true in rural or impoverished areas, and that needs to be attended to. So to successfully deliver prevention programs and replicate the effectiveness of trials, this local capacity must be deliberately built through training and technical assistance. And such capacity building can require significant resources, and if we don't budget for that, we can undermine the whole prevention effort. So while the field of prevention science has come to agree that such capacity building is essential for successful prevention, only very recently are we seeing cost analyses reflecting these resources and the resources that are required. So for instance, Dr. Kuklinski's research with the communities that care model explicitly seeks to capture this, and this is part of what we've already been talking about today. Similarly, Dr. Damon Jones, who will be speaking later today, and myself have carried out work with a similar prevention delivery system known as Prosper, and we've sought to explicitly capture those costs that deliberately capture not only these day of implementation costs, but the cost of building an effective and sustainable prevention effort. So such infrastructure building can be divided into three main areas. And so we can think about it in terms of adoption, implementation, and sustainability capacity, where adoption capacity refers to the ability for a local community to select and be trained in or draw on new labor that can be trained in an evidence-based program, prevention program in this case. In particular, this involves local capacity to understand the needs of the target population as well as the fit of the program. So we can look to Chris Ringwald's work, which has illustrated that adoption capacity of evidence-based prevention strategies nationally is very low, and it often requires considerable assistance. So strategies such as the Communities That Care's needs assessment, as well as Prosper's menued approach, both seek to supplement this local capacity when it's lacking. Similarly, so in terms of the next category, implementation capacity represents both the ability to deliver the program, generally from a manualized curricula, but also to ensure programming quality. So many communities lack existing quality assurance systems that are compatible with many of the prevention programs that are currently available in the marketplace. So developing these systems can take time, but they are essential to ensure prevention services are delivered with fidelity. Lastly, sustainability capacity refers to the ability of a prevention effort to integrate a program into the existing service infrastructure and develop robust funding streams to support programming. So this requires training and ongoing technical assistance around fundraising, management of in-kind and volunteer resources, and in many cases, actually expansion of programming in order to remain competitive and create braided funding streams for local prevention. So here we see cost estimates of what it actually takes to build capacity in these three areas. So this is from a 5-year cost analysis of 7 rural communities, and what we see here is that these costs are not inconsequential. So this is 7 different community prevention efforts, but what we also can notice is that they're dynamic and they vary greatly across time. And so the resource needs for building a successful prevention effort need to be understood before researchers can be assured they've developed a full cost estimate of a program. So because of the complexity of doing this work, I would like to say it may benefit the field to take a closer look at prevention systems such as Communities That Care that allow for different programs to be deployed depending on local needs. So these, if you will, kind of plug-and-play systems allow program evaluators to include infrastructure development in the cost analyses with somewhat less research burden than if they advocate, say, a program be implemented in isolation, where that capacity needs to be developed without the assistance of some sort of system. So the next area that's often neglected, which we've already started talking about, and I'm really glad we have, because this is not usually something that comes up, so I wasn't expecting it, and is around volunteer and in-kind donations. So prevention programs, because of their attempt to avert a future outcome, they often require substantially greater buy-in than downstream solutions that seek to triage existing and visible problems. So as a result, prevention initiatives will often rely heavily on local volunteer and in-kind donation, because rallying these resources not only solidifies buy-in from the community, but can also help alleviate resource scarcity. So it's not just about capturing these other financing streams, it's also about actually building buy-in. It's an essential component of what makes prevention effective when it's delivered within a community context. So often when program evaluators have sought to estimate the cost of a program, it occurs retrospectively. And institutional knowledge, as Hank was talking about, institutional knowledge of what group donated which resources and which people volunteered their time when, it's ultimately lost, and then it's left out of the cost analysis. So this is particularly a threat to programs that rely on existing service infrastructures to house their programming. For instance, the education system has often been the natural home for preventive interventions targeting adolescent populations, as many of you know. The opportunity costs of the program may be small when they're delivered within trials, but when they're delivered at scale, they often require sizable investments from local education systems. So this includes not only the more visible teacher time, but the less often considered administrative and staff time. Ultimately, these costs, they must be captured because when they're not, they threaten programming planning and place an unexpected burden on service systems, which can derail the whole effort. So further, often prevention programs seek parental support. And if this is an essential element of a program, which it is for many family-based programs, home visiting in particular, then it does represent a cost. So this kind of so as we move through this and think about, sorry, this is actually what I just said. I got a little carried away, but as we think about that, parents though are also targets of many of our programs, and so so when we start thinking about participant costs, we think about the cost of to the child, the cost of the parent, the cost of the family, and so the third area I'd like to talk about in a little bit more detail is around these participant costs, because we started talking about them, and they are essential elements, but they also require some special handling. Specifically, sometimes these costs, they're incurred up front, often through losses in time, but sometimes they are incurred as part of program effects themselves. So for instance, preventive programs that improve parent success in the labor market can lead to losses in, say, means-tested programs and a cost to children. But the hope is that child participants will net an overall benefit for receiving the whole program, but those costs and their timing, in this case, say, potentially losing child care, are still really important to recognize, both for participant protection and also program recruitment purposes. So that once again, the idea that our economic information, specifically around costs, can inform program planning. So measurement of participants' costs from programs is, maybe not so surprising in the context of our conversation, a pretty underdeveloped area of our science. And generally, these costs are solicited through 2 items, self-report interviews, or identified in the context of outcome evaluations that recognize some sort of loss of service. This approach can be useful, but fails to capture the complexity of program costs, especially in the context of increasingly dynamic preventative efforts that we're seeing. Specifically programs that are being delivered across substantial periods of time. And so these cost analyses that do estimate participant costs may estimate the mean cost, but in reality, there's so much more to be studied here. So with the development of more robust data collection systems, particularly through new technological supports to prevention efforts, the field can dramatically extend the science around prevention's costs. So I'd like you to take, for instance, geographic information systems that we're seeing being deployed by many community prevention efforts. So for instance, the CDC or local crime mapping, we're seeing it deployed in a lot of different areas. So GIS, what it does is it allows us to rapidly understand the location of community resources, but these systems can actually be easily deployed to capture costs as well. Take, for instance, participant travel time to participate in a family-based program from their home or work to a program site, say their child's school. So in rural areas, not only can these travel costs be substantial, but they are distributed unevenly among the participant population. So using address lists from program intake, researchers can now accurately estimate the travel costs at the participant level, and that's key, in a few hours as opposed to the weeks needed for participants. So in terms of the research burden of actually doing this work, we're seeing technological solutions that I think will help guide our work in terms of standard setting, because there's things that we can expect of researchers that we at one point maybe couldn't have at all. So These travel costs not only will inform the final cost estimates that we have, but they can be used to actually predict program participation and attrition. So they become part of the science itself, the science of the costs of prevention. So further, looking to the future, behavioral prevention efforts have embraced many e-health mediums to disseminate programming. For instance, web and mobile-based interventions that not only facilitate program reach, but the data architecture embedded in these programs collects a tremendous amount of data. And this is a bigger conversation that we're having in society about data collection, of course. But specifically, these preventative interventions are collecting data about when and how participants interact with the preventive intervention itself. So this data is ripe for cost work. Take, for instance, there's an ongoing economic analysis of a year-long obesity prevention program with goal tracking through a virtual trainer and phone-based coaching with registered dietitians. Every time the participant interacts with the system, their interaction is timestamped and automatically entered into a data set. So from this data, we can actually estimate each participant across the year with multiple interaction sources, their daily costs. And this data, so as you can see, this is actually data from that trial. This data is dynamic, it's robust, and even just visual inspection of it highlights there's clear trends when participant costs are high and low. And as more robust data systems such as this one come online, and they're coming online as we speak, our study of participant costs is likely to move from a largely descriptive enterprise to potentially one with a rich kind of rich inferential modeling around what participant costs are. And I think this has huge implications as we think about personalized medicine and how behavioral prevention for children and families fits into that. So now, with the remainder of my time, I'd like to attempt to provide some synthesis around some of the best practices for costing prevention and where there might be agreement that could inform the development of minimum standards, so what we've been talking about. So specifically, first, cost analyses should always be prospective. I know this is something that Hank's already talked about, we've already talked about as a group, and I really want to reinforce it. But failing to include a cost analysis at the beginning of trials and having instead having these retrospective estimates makes not only the process of estimating costs so much more difficult, but it dramatically increases the likelihood that cost estimates will be incomplete. So, as I hope that we've conveyed with this session, cost analyses are so much greater than simply totaling a budget and require real and meaningful forethought. So if we can accomplish anything here, it is to emphasize that cost analyses should be prospective and they should be developed concurrently with program evaluation. And ideally, funders that support prevention trials and researchers reviewing funding proposals will one day always expect a program evaluation to include capturing opportunity costs, which takes me to the next potential best practice that I think we can identify, and that's in the many years that it's been around, the ingredients-based approach is really our best bet for capturing a full economic accounting of a program, not just getting caught up in budgetary costs and looking at specific financing streams. So specifically because the ingredients-based approach deconstructs the resource needs into specific cost categories, we can develop more standardized protocols for cost collection and work to link resource consumption to actual program activities. So third, cost analysis should always seek to estimate the full economic costs of implementing the program. And I think Hank covered this really nicely. In particular, costs and estimates should move beyond simple budgetary review and always include all the resources needed to replicate the program effects. So specifically, to replicate the program effects, if you need that resource there, then it should be part of the cost. And this includes resources to build local capacity, the cost of donated time and goods, as well as a full accounting of participant costs. And what that is something I think that as a group we can start to talk about. So further, uncertainty in cost estimates should always be explored. I think that the first panel and now us, I think this is a really central theme that's going to be on both sides of the benefit cost equation. And so, even more so, justice effectiveness estimates are always discussed within a range of variability. Cost should be as well. Sensitivity analyses should test the robustness of cost estimates under a variety of assumptions. And those assumptions are things that we can identify potentially in forums like this. So, and whenever possible, simulation analyses should be used, and we can use a Monte Carlo analysis just like we do for valuing the outcomes or the benefits of the outcomes. We can also use it for costs, and we should estimate specifically confidence intervals around our point estimates. So, in this context, cost analyses are the foundation for much of the economic work we hope to facilitate in prevention science, and there are best practices for carrying out cost analyses, which can be used to improve the quality of research around prevention's economic impact, the quality of what we do. So thus, drawing on these best practices and the background presented here, we can consider 4 areas of cost analysis that would potentially benefit from greater standardization. So as we start to think about where we could go from here. And I think that these include identifying essential cost categories that all cost analyses of prevention should strive to include. So when we talk about the ingredients, what are those ingredients and what are the common ingredients that are shared across prevention? Number 2 would be developing guidelines for the appropriate handling of costs that are not reflected in program budgets. So this very much fits into what is that donated time worth, how do we handle it, how in CTC they handle it in 3 different ways, and I think that's great, and we can probably learn a lot from that, and maybe that's the way we want to move forward, but that's something we can definitely talk about. Number 3 is minimum levels of sensitivity analyses to explore uncertainty in cost estimates. Maybe not every cost analysis requires a full Monte Carlo simulation to go with it, but there are essential assumptions that should be tested, and I think that we can make some statements to the field about what those are, or a forum like this could. And then 4th, the consistent reporting of cost estimates to enhance transparency and utility. And so this is a little bit more meta of what we're talking about here, but how do we actually report how we got to our cost estimate? And so, for instance, the ingredients-based approach uses a table that can be reported, and it's very clear and has comparable cost estimates and allows us to be comparable and also allows us to be transparent. The transparency on cost estimates is, well, dismal. So thus I'd like to conclude with one last observation, specifically that growing interest in early investments have placed prevention programs, especially for children, youth, and family, increasingly in the spotlight. Yet as a field, we often struggle to provide even descriptive information of what these efforts cost and how communities should make an investment of one over another. And at its core, a well-done cost analysis can describe this investment. That's what it is. It's describing the investment of prevention. Not simply a dollar amount, but how and when resources are needed to enter a prevention system, build local capacity and support actual programming, the actual implementation on the ground. So today, as we seek to further the science of investing in children and their families, I think that we really must continually seek to weigh every side of all of our prevention decisions. So what are the costs? What is the return? And ultimately, how does this investment follow children throughout their lives? So, thanks.